Good afternoon, everyone. Happy Wednesday and Happy New Year. I know we haven't seen people since December of 2020, and we're now in 2021. Thank you all so much for joining us on this update. Please take the time as you enter, as people start trickling in, to introduce yourself into the chat, your name, your organization. We also have closed captions available, so you could just press the button down below for closed captions if that's something you need. So feel free to introduce yourself in the chat and we'll get started in just a second. All right, as people continue in the chat, we're going to get ourselves started. I'm going to introduce our first speaker, Dr. Lowe, to give us a public health update. As we continue on, please feel free to use the chat to put questions that you have either for Dr. Lowe or for any of us. I'm not sure, Dr. Lowe, if you'll be here the entire time, so feel free to answer questions as they come into the chat. So we'll get started. Dr. Lowe, pass it off to you.
Good morning, everyone. Thank you so much for inviting me to speak with you today. I'm just going to do a quick update on COVID-19 vaccinations. I am here until 12:30, so happy to answer any questions until then. Next slide, please. So this is just a very high-level overview of our COVID-19 positivity for our Boston residents. There's two separate lines on here. There's the orange line, which represents our positivity without colleges, college and university cases. I'm sorry, without college or university testing in there. And the green one is with college and university testing. And the reason why we have two separate lines is because colleges and university, many of them test their students and faculty regularly, once to twice a week. And so because of the number of positive tests, that can really dilute the positivity. So we keep it separate just so we can keep an eye on what's actually going on within the community. Positive cases are still looped into as part of the positivity for the city as a whole. So as you can see, we are currently at 3.5% positivity. That's the number of positive cases over the total number of tests being performed at the city in the time. You see the downward trend, which we are very excited about. This is in comparison to our peak, which was around 8.9% positivity. We peaked right the week after New Year's, basically the post-holiday peak. Just in terms of number of cases, this is in comparison to, right now we're at about 100, I think we're about 100 plus cases, 115 cases per week on average. Around January, we are at about 530 cases on a week per average. And back in April, when we were in the midst of the first surge, we were at 330 cases on average per week. I will state that the April surge was, although it was lower than this January surge, it was when testing was really unavailable and our death rate was significantly higher back in April than most recently. So again, all downward trends. We're very hopeful that will continue to go down. We are keeping a close eye on it, especially with new variants coming in, restrictions opening, easing up, and the vaccine in play, which is very exciting. Next slide, please. So this is the Massachusetts vaccination plan, which is created by the state in concert. They did have a Massachusetts COVID-19 advisory board to help shape this. So again, this is information provided by the state, and local jurisdictions are responsible for implementing the distribution plan. So we are through phase one right now. Phase one was primarily reserved for those who were either most impacted by the were highest risk of getting COVID-19 and having serious consequences related to COVID-19 infections, or were most likely to be exposed to COVID-19 infections. And that includes their healthcare workers and first responders and those in congregate care settings. So everyone in phase 1 is still eligible to be vaccinated if they chose not to get vaccinated earlier on in the season. They are still eligible. We are currently in phase 2, which is individuals 75 plus. I'm sorry, we're in the second level of phase 2. So individuals 75 plus, individuals 65 plus, or which would include those in 75 plus, and then individuals with 2 or more comorbidities. And there is a very specific list of comorbidities or medical conditions that a person may have that puts them at higher risk of severe illness. And so that list is actually on the mass.gov site. So that's where we are now, is at the second level. So everyone in those first 2 groups of phase 2 plus phase 1 can go online to the Massachusetts it's mass.gov, and then there's a link to a website that you can make an appointment anywhere in the state that's on that list for a vaccine. K to 12 workers, there was an announcement by President Biden yesterday evening, and there should be one from the governor coming up. And if it hasn't come out already, it's going to come out today in terms of when vaccinations will be available for those employees. And then the rest of essential workers will be eligible in the near future. We don't have an exact date about that. And then after that, we have individuals with one of those medical conditions that puts them at high risk of severe illness, which is, again, that list that I referred to previously. That's on the mass.gov website. And then phase 3 will be general public. And as I said, President Biden announced that we potentially could have enough vaccines for all of our adults by the end of May, which is very, very exciting. Next slide, please. This is our vaccination plan. And so, part of getting that vaccinations to people who want it are setting up models of vaccination clinics and sites that are most accessible to our population. I should say the precursor to this is our communication plan, and we have been developing a communication strategy in multiple languages with postcards in multiple languages, speakers who speak different languages, and with different community groups around the city, because we can have all the vaccination sites in the world, but if people don't have the information that's accurate, that's true, they may or may not choose to get vaccinated. So we're really emphasizing our communication plan. And then those who choose to get vaccinated, we have these 4 models to make vaccine accessible to as many people as possible. So the news has been probably the most around model 1, which is our mass vaccination clinics. And so again, you could go to the mass.gov website, and there are sites all over the state. The 2 that currently exist in sorry, they're bunched together. They're Fenway and Reggie Lewis Center on 2 different sites. And they have the capacity to do up to 1,000 a day. I think Reggie is ramping up to 1,000 a day. They're at 800 a day. And similarly, Fenway is ramping up to 1,000 a day. Hines Convention Center is a potential site in March when baseball season starts. So there's still discussions under that. But you've probably heard about Gillette, Natick Mall, et cetera. So those sites are all available to those who are in those eligible categories. The second model is priority group clinics. And so those clinics are really focused on identifying those specific, the workforce that might be eligible, just to ensure that our workers who are on the front lines can get vaccinations. And we've been doing these priority groups clinics. We've been working with our partners to do these priority group clinics since the beginning of the vaccination efforts. Initially, hospitals were vaccinating their own staff, and then we worked with our clinical partners to vaccinate first responders. As we move towards essential workers, we'll be helping vaccinate our sanitation workers and et cetera. So that's an ongoing program right now. The third model, the community-based public clinics, are probably one of the key strategies in ensuring that folks are accessing vaccines and where they're most comfortable. So the idea is to set up these smaller clinics that really partner a community partner with a clinical partner, knowing that people trust their community members, people trust their health centers, people trust the community organizations that to which they belong. And so creating those partnerships and putting them in neighborhoods that are most impacted by COVID-19. So I didn't give the neighborhood data, but Mattapan, East Boston, Roxbury, Dorchester, and Hyde Park have been some of the neighborhoods that have been hardest hit by COVID-19 infection and death. And those are also our communities with the highest proportion of Black and Brown community members. And so we're already working with partners partners have been setting up sites across those various neighborhoods. And our goal is to have at least one site, if not more, within every neighborhood, in every zip code across the city. So we're working towards that plan now. Sorry. And then the last clinic, the last mobile vaccination clinic, the last strategy is the mobile vaccination clinic. And so again, identifying, meeting where people are at and ready to vaccinate. There are folks that have difficulty either leaving their location or their home or whatever to get vaccines, or they would be most comfortable when the vaccines are delivered to them. So tomorrow, I believe, we're starting a vaccine effort, mobile vaccine effort with our our EMS team going out to a Boston Housing Authority building to vaccinate about 100 people tomorrow. And this is going to be an ongoing effort. We're going to create a couple teams. We're also thinking about using this strategy, hopefully in the next month, about vaccinating our homebound individuals or those who really just can't leave their home. So those are the 4 strategies that we're currently implementing across the city to vaccinate as many residents as possible. Next slide, please. And I just, you can't obviously tell where these locations are, but if you go to this website, you can identify where there are vaccination opportunities in the city. The website itself will have a mix of specific locations that, for instance, there will be health centers on there that are vaccinating just their patients. And then there will also be vaccination sites that are open to the community. The city of Boston is trying to identify a call center for those who do not have access to the internet in order to make vaccines, to make vaccine appointments. So right now, for those who are 65 and older, they can call 311 and they'll be routed through our Age Strong group to identify a vaccine appointment for them. And we're working to identify a call center for those who are under 65 with appropriate linguistic capacities for those folks who don't have access to internet in that way. So I think that's the last slide. Is that the last slide? Do you want to check? Yeah. Thanks. I haven't. Go ahead.
If you have some time to answer some questions, if that works for you, Dr. Lowe.
I do. I haven't been paying attention to the chat, so I'm not sure if there are specific questions. Oh, yeah, lots of questions.
Yeah, I can read them off to you if that helps.
Sure.
So we have a question from Deborah Cash. Question is whether teaching artists who are not school employees are eligible for phase 2 inoculations under the teaching rate.
So right now, if you are work in a kindergarten to 12, or I shouldn't say, when kindergarten to 12 workforce becomes eligible for vaccinations, if you are in that location, if you work in those locations, you will be eligible.
Are the Boston sites for Boston residents only?
No, the Boston sites are for all individuals. However, some of the sites are reserving spots for communities that are hardest hit. So all of the sites are open to all individuals. Yeah.
Where do universities fall within the vaccination plan?
So it really depends. So universities, individuals fall within whatever category they are. So if you have two or more medical conditions that put you at highest risk, you can go to any site. If as a citizen, as a resident, universities collectively actually fall into the general public. They don't fall into any of those categories. So healthcare workers within universities have already been vaccinated. Food service workers have already been vaccinated, or I'm sorry, food service workers will be eligible for vaccination in the next prioritization group. So I wouldn't look at prioritization in terms of universities as a whole, but rather which there's a specific category that you work in, or if you have colleagues who work in or fall under the comorbidity or age prioritization group, that's how you would be vaccinated. But otherwise, universities fall under general public.
Great. I think those are all the questions I'm seeing right now in the chat. What are these sites' plans for surplus vaccines?
I'm not sure what you mean by surplus vaccines.
I think they're implying if let's say they have an overflow, they have an extra amount.
Extra at the end of the day.
Yeah.
Yep. So each site has a list of a wait list. So for instance, community health centers are identifying, if you're affiliated with the community health center or clinic and you're interested in vaccination, you can be asked to put on a wait list, and they'll notify you if there's extra doses at the end of the day. Each site runs differently. So at Reggie Lewis, when Boston Public Health Commission was operating it, we collected names from community partners, and we were trying to collect names in the immediate vicinity of Reggie Lewis, so that if you had to get there, you could get there, and then with it under an hour, because that's really the concern, is to not waste the doses. So it's really dependent on which site you're talking about.
Great. So I know you'll be here for 9 minutes, so maybe if other people have questions, feel free to put them in the chat, and Dr. Lowe would try her best to catch them and answer them as she sees them come in. Thank you so much, Dr. Lowe, for the information. We truly appreciate it. All right, I'm going to hand it off to Cara to talk a little bit more about the guidelines that are opening up there now and in the near future.
Great, thank you. And for those who might be new to this call, I'm Cara Elliott-Ortega. I'm the Chief of Arts and Culture, and it's good to see a lot of familiar names still wanting to come together and get relevant health information. And thank you, Dr. Lowe, for being able to join us for a little bit today. So I want to start by just reminding everyone about the testing sites. We're still really encouraging folks to take advantage of this, continue to get tested. This is what's informing our public health data and helping us make sure that we're going in the right direction. We were able to use the Strand Theater as a testing site. That's available now in Upham's Corner. There's also locations in Grove Hall, Hyde Park, and Jamaica Plain. And you can find more information about times and availability at boston.gov/coronavirus. And next slide. So I want to talk a little bit about the reopening guidelines with the caveat that we might not be able to answer questions about everyone's kind of different scenarios that you're imagining coming up in the spring. But please put your questions, whatever they are, even if we can't answer them right now, in the chat. We're going to be able to follow up on everything and probably have another one of these calls the week leading up to March 22nd so that we can get into a finer level of detail. But I'll go through these for right now. The state announced guideline changes that are going to go into effect in Boston no sooner than March 22nd. So that means Boston was going to allow the following on that date, assuming that our health data continues to go in the right direction. So that's indoor performance venues, concert halls, theaters, and other indoor performance spaces at 50% capacity with a maximum of 500 people. Indoor recreational activities, some examples of what those are, at 50% capacity. Museums and retail will also be able to increase to 50% capacity, and you'll see 50% kind of across a few different industries as the new capacity allowance. And restaurants will no longer have a capacity limit, They still have the other limitations, 6 feet between tables, no more than 6 people per table, 90-minute limit. And they will be able to have live musical performances as well. Again, for all of those, City of Boston will not be moving into that phase until at the earliest March 22nd. So yes, a note of caution to everybody that this all depends on the public health data continuing in this direction. I'm assuming also that we're going to be in a situation where the city may still be more restrictive or have some additional guidelines around some of this once we get there. And I know there's going to be a lot of questions in particular about that we're already receiving about permitting and allowing outdoor performances on city property and how that's going to be handled. That might be a situation where we still have some additional guidelines that don't go as far as where the state is. And for example, we're not planning on reopening the Strand Theater on March 22nd. So that's, we're not going to be there yet for our own activities and events and performance spaces. So I think with that, let me just take a pause and start to go through some questions here. So Abigail, will vocals and or winds, horns be allowed? I think the answer to that indoors might still be no. I don't know. Emily, do you have, yes, Emily's raising her hand.
So as I understand it, singing will not be allowed, but that was last week prior to the formal announcement. That has changed, but that was what was told to me.
Great, thank you. From Temple. Oh, outdoors was the question. I think outdoors, it will be allowed. So I just took a pass through the event guidelines, and I think that will be allowed. Are there any 6-foot distance requirements with the 50% capacity for performance venues? That's a good question. I think the answer is yes, but let me double check that. Yes, we can post a link to the guidelines. We'll grab that and put that in the chat. I think something that would be helpful to hear from folks is, my note of caution and, saying that we're not going to be reopening the Strand on March 22nd is also to say, I don't think that any of us could really plan on taking full advantage of these guidelines immediately, both because we can't promise that the City of Boston will reopen at this level on March 22nd, right? We're saying we really need to see where the public health data is, but also, I think it's going to be a challenging space to be in messaging wise. And I'm curious to hear how people are thinking about, what their audiences and staff will have an appetite for in terms of immediately reopening all of your facilities and programs at these levels, even though they're still not at 100%. Yes, I think, so the question here, is it likely that we could rehearse full orchestras outside, and who would like one in their backyard? I think that does seem likely. So one of the things that we're going to try to have conversations about with our permitting folks and parks between now and the end of May are, if there are additional guidelines around doing outdoor performances, what do those really look like and how can we make those clear and realistic to people? I think one of the sticking points last year was how do you keep folks from gathering if you are doing an outdoor rehearsal of an orchestra, what does that look like? So that's part of what we want to be able to wrap our arms around and make really clear for folks. Is there a requirement for the distance between the audience and the performers for indoors? I will have to double check on that. I know that there have been up to this point, or there were before we took a step back in the restrictions. So we'll look at both. That's similar to, are there 6-foot distance requirements for the indoor performance venues at 50%? So we'll get that answered. I don't believe that that includes vocal performances. So the question is, if you're performing in a restaurant, are you able to do a vocal performance? And I believe the answer is no.
Just to reiterate, that is what I was told when I spoke, when ahead of the news coming out, is that singing would not be allowed indoors. However, in a week that may have changed, but that is what I understand it to be.
Okay. Any other immediate questions on reopening? Feel free to add more things into the chat as they come to you. Thanks, Emily. And like I said, we'll probably have another one of these either that week leading up to the 22nd or the week of the 22nd. Lindsay, what is the current situation with hosting public classes, dance movement, or acting? I think that a lot of this is going to fall into the updated capacities and guidelines for other areas. So whether that's retail spaces, there are some specific guidelines around youth versus adult classes. So I think we'll have to look at that and see what if those are still being updated specifically, or if they fall into a larger category. Are there any new guidelines on unmasked activity as related to filmed performances with no live audience present? No, and so I should clarify that between now and when we go to the next phase, we'll still be able to approve rehearsals or live streams that meet the indoor guidelines on a case-by-case basis. So we will need to revisit what those guidelines need to be starting on March 22nd.
Tara, is it okay if I add something?
Yeah.
So I don't work for the city of Boston. I work as the executive director of an advocacy organization, and we spend most of our time trying to inform elected officials and decision makers on what is best for our sector. But if I may, and I understand this is being recorded, I think there's an opportunity here for us to be creative and to read these rules and want to follow them, but also figure out ways that we can do the work that we need to do, right? So I'm just going to put a little point in there around that. Obviously, if there's a clear no, you can't do that, you can't do it. The other piece around filming is there's an amazing advocacy organization called the Mass Production Coalition that probably has exactly the information that can help with that question. There has been filming that's resumed in Massachusetts. And so I think that's another opportunity for us as a larger sector to say, these are apples and apples. So let's start following those guidelines.
So I'm just looking through some of the other questions here. We don't know when City of Boston will be at 100% capacity and allowing singing. I think there are some related things to think through on our end, also related to Peter's question about at what point will there be enough people vaccinated that we're moving towards phase 4, but also when we're updating guidelines to reflect that you are going to be working with people who may be vaccinated, and how we sign off on that or not, or what the guidelines are from the city related to how many folks you're working with, who you're bringing together, who are actually vaccinated. So we're not there yet, but this is helpful to have so that we can follow up and make sure that we're thinking through all of these different scenarios. Pascal, am I missing anything in here?
I think
Backtracking.
you've gotten most of them. Yeah. Seems like I think all of them. Yep. Looks good to me.
And I would say if somebody has a specific question, like Mark, I'm looking at your question about unmasked activity related to film performances with no live audience present. If you have something scheduled that you're trying to figure out, I would say during the month of March, please email us. We'll put our emails in the chat and we'll be able to get you an answer on your specific situation that you're trying to think through. We have had a couple of people say, I'm doing an interview with somebody, we're on opposite sides of a room, the interview is 15 minutes long, can we take our masks off? And we've been able to sign off on those things on a case-by-case basis. Yes, Susan. So this is going to be part of what we are working with our permitting and parks colleagues on. Like I mentioned earlier, I think one of the biggest concerns is that if there are summer concerts or different performances outdoors, how are we ensuring that folks aren't gathering without putting an unnecessary burden on you? So, what that might look like in normal times is having to put barricades all the way around an event. But we don't want to have everybody adding the cost of doing that and the infrastructure of doing that just so that they can have an outdoor concert. So we're trying to think creatively about what that does look like. Are we working with parks to draw kind of physical distancing circles on the ground in some specific places and then pointing you just to those places to have outdoor events so that we don't have to recreate that everywhere. So we're thinking through some of that now. Okay, so I think keep adding your questions and I'll be in the chat. And I think we will pass it over to Emily for a MassCreative update.
Thanks, Cara. So obviously, reopening is an issue that we are all very sensitive to, and we are all collectively looking forward to full reopening. And while that is happening, we are also still working on the fact that our sector has had an enormous economic, I would say, shatter shock, and that relief on a couple of different levels is really needed. And that's where our advocacy has really been leaning into recently. So I just want to give you a couple of updates. So on the federal level, I'm sure many of you have been following that the newest COVID-19 relief bill that was created and authored by President Biden and a Democratic House made it through the House last week. You can see some of the data points around, or some of the points that are included in that bill, around funds that would impact the creative community as well as our workers. And then there are more, but those are just a few of the highlights. It is now with the Senate. The Senate is talking and saying that Schumer's very much wants to see it happen this week, that it gets a vote this week. So we are watching that. The other piece that I know many of you are paying attention to is the Shuttered Venue Operator Grant Program, which this Small Business Administration has been furiously working on standing up. This came out of the Save Our Stages legislation that was included in the calendar year end relief bill, and would creates a $15 billion fund for independent live venues, both for profit and nonprofit. So I'm sure several of you on this call share in frustration about how long it's taking for that program to roll out. I would point out, and I'm trying to keep in mind, that this is literally a program that affects different business models, nonprofit and for-profit, and that they are trying to figure how to get that out and stood up as quickly as possible. So there are a couple of resources that I want to draw your attention to. One is the SBA created a Shuttered Venue Operator Grant website. They have been updating their frequently asked questions pagers almost every week. And that is something that has more details about who is eligible and how to be eligible. The other piece is that the Mass Live Events Coalition, which is a newish coalition of events workers, is collecting questions that you might have around the Shuttered Venue Operator Grant to share with the SBA. I think we're really trying to urge people to, if you have questions, to collect them with the Mass Event Live Coalition so that we can have like a central repository to get those questions to SBA and get them answered. The other piece, which is kind of exciting, is that the Small Business Development Center Network is going to hold an informational webinar on March 23rd from 4 to 5. And Pascal, I'm sure like every one of these meetings, you're going to be sending out this PowerPoint deck, and you'll see it's hyperlinked, so you can register for that. That will be probably the only informational session that the SBA will be participating in Massachusetts. So the Massachusetts SBA office is working on this with that network. So we are still going to try to push out as much information as we have it, but that is a really great and important webinar to attend if you think you're eligible, if you want to make sure you're eligible. Christina, next slide, please. So then on the state level, the budget feels like, oh, those past days when all we worried about was the state budget. There's many more things to worry about, but I do want to point out. So Baker released his version of the budget, his budget proposal for fiscal year 22. He made a recommendation of $16 million to the Mass Cultural Council. Obviously, that represents a $2 million cut from last year. The good thing is that this is literally the recommendation that Governor Baker makes every year. And every year that happens, the MassCreative, the Mass Cultural Council, and all of us as partner advocates have worked to make sure that the legislature has moved it above 16 million. And we're going to continue to do that this year. So next week, the Joint Committee on Ways and Means is going to hold their hearing. That's when all of the various agencies will testify in front of that committee and talk about what their request is for this year. The Mass Cultural Council is still working on exactly what their number is going to be, but that is sort of the next immediate step in the process. And then after that, the House will, Ways and Means Committee will develop their draft budget to be debated. So what can you do? Right now, you can reach out to your legislators. You can make sure that they know that you prioritize and support an increase in the Mass Cultural Council budget and that you are paying attention to that. And this is part of I would say a three-legged stool of our recovery, is making sure that we have ongoing public support for our ongoing programs, right? So that still remains a priority for all of us. Next slide, please, Christina. So the other thing that's happening is the 192nd legislative session is heating up. It officially started at the beginning of January, and 2 weeks ago was the deadline for legislators to file all their bills for the session. It's a 2-year session, so it'll cover 2 budget cycles, fiscal year 22 and fiscal year 23. And within those 2 years, all the legislation that's filed will have a hearing, and then we'll make a recommendation, and then that whoever committee is holding that bill will make a recommendation about next steps. So the thing that we've been paying close attention to is a bill that was filed by Senator Edward Kennedy up in Lowell that would create the COVID-19 Cultural Economy Relief Fund. It would take $2 million of any eligible state and local aid that's sent from the feds in any upcoming relief packages, hence why I brought up the federal relief package that we're looking at right now, and create this fund. The fund would be administered by the Mass Cultural Council. It would look to, nonprofits will be eligible, for-profit entertainment and live event spaces would be eligible, as would individuals. So this represents a really comprehensive piece of relief legislation in Massachusetts. The other piece is that it's going to consider racial diversity and equity. It's going to also consider diversity of programming and geography, as well as prioritize impact on job creation and tourism spending prior to the pandemic. So we're really this bill is really trying to take a look and say, like, what is the ecosystem of the arts and cultural community in Massachusetts, and how do we stabilize it until it can fully reopen? This is like the big one. Like, if you ever ask me, like, what Emily, when do I pick up the phone and call my legislator instead of just shooting them a note? This would be it. But if you want to, the first thing you can do is you can reach out today. So there's a link in this that will link you to our action alert that will very simply help you get the right message to the right legislator. We already have some co-sponsors, but we really need to get a lot of co-sponsors on this bill. Guys, this is, I think, the largest ask we've ever made of the legislature, and this is a really concerted ask. And so in order for us to do this, we need to demonstrate that we as an entire cultural community are saying, this is it, guys. This is the thing that we need, and we need it now. So on our website, we have a summary of the bill. We also have a running list of who the co-sponsors are. And we have the hyperlinks that will take you both to this action alert, as well as to a page on our website to endorse this bill. My hope is that over the next week, we can get so many endorsements that we can do a nice, sturdy press release that says, over 600 cultural organizations and individuals endorse this piece of legislation. This is what we need. This is what it means for the creative sector. So how is the number 200 million settled on? I'm sorry, I don't mean to be flip. So obviously, the Mass Cultural Council has data that tells us that as of October, nonprofit cultural organizations and individuals reported approximately 500 million in losses. We also know that there was a recent survey that they just did, and we expect those numbers to come out shortly. And if I were a betting woman, I would say those numbers are going to go up. So obviously saying tying it directly to 500 million would make a really good data point connection right there in terms of our argument. But then there's also the appetite of the legislature to consider. And so it was a negotiation and sort of figuring out what was the number that felt right, that legislators could really get behind and support. And so that's how we got to 200 million. I will note that according to the last estimate that I saw in terms of how much money Massachusetts will receive in this upcoming COVID relief package, combined between state and local governments, we're looking at about $8.4 billion. So, this is not I would say, disproportionate ask, right? So that is another piece. If you get pushback from your legislators that say 200 million, that's a lot of money. I think we can first say, as Catherine points out in the chat, we know what the number is for nonprofits and individuals, but that doesn't take into account for-profit businesses, arts businesses that have been really hurt during this period of time. And so the need is very great. And then you can also say, this is not coming from state coffers. This is coming from federal relief money that's coming in that has identified economic recovery as a priority for that, at least in the House version of the legislation. And it is not an overly large ask compared to the amount of money that's coming in. So that is what I'm hoping we can all work on. The other thing, obviously, on this slide is that the committee assignments were made. So I don't know if you, like me, enjoy looking at the Oscar nominations when they come out, but this is the political equivalent of that. You can see which legislators are chairing and vice chairing which committees. You can see who got moved around. We have a new chair on the House side. We have Carol Fiola from Fall River will be the House chair for Tourism, Arts, and Cultural Development. And we have a returning chair. Senator Kennedy has returned. He actually requested to stay with the Tourism, Arts, and Cultural Development Committee, which I think speaks to his passion and his sort of decision that he sees a real need in making impact in this area. So we are really glad to have those chairs join us in leading this work inside the building. So I think that's all of my slides. Christina, am I lying? Nope, that's it. So that's what we've got. So, we're all being asked to do a million things right now, and as a community and as a collective. And so I really, frankly, very much value all of your collective advocacy and hope you will stick with it in partnership with us. That's the only way this works. And then, I know that there is still advocacy needed around reopening, both in terms of clarity of guidelines and then what makes sense to our sector. And so please do keep those questions going. They're also helpful for me as we're trying to build lists and build conversations with key folks inside the Baker administration to make sure they know what our sector is up against and can better serve our sector. So I think that's it for me. Thank you.
Thanks, Emily. I'm not sure if you caught Deborah Cash's question about the list of co-sponsors on the MassCreative site.
Yeah, the list is there. It's frankly, there are 3, I just took a look, there's 3 more co-sponsors, so it's out of date by 36 hours. But we will be updating that pretty regularly.
Great. If people have any other questions regarding guidelines, questions for Emily, feel free to put them in the chat. We just got one question. If we could put the co-sponsor link in the chat. Thanks, Emily. So we'll get that.
I would love to.
Perfect. Thank you so much. And if you have any questions regarding opening, please email arts@boston.gov. Cara just put that in the chat as well, especially as things are changing quickly, but by March 22nd, we're happy to provide as much information as we can at this moment. Cara, anything else you want to put in the space before we close out?
No, I think that's it for right now. I know it's still really hard, if not harder, to plan. And we're trying to get everything kind of answered and particularly more teed up for outdoor activities as possible so that things can be a little bit more plug and play than last year. Please stay tuned. We'll do these so that we make sure we're getting everybody information. And yeah, email us at arts@boston.gov with any specific questions. I do not know when phase 4 guidelines will be released. And just for those, just a little bit about the kind of state coordination here. We received this latest round of reopening guidelines on the same day that the state announced it publicly. So we're always playing like a little bit of catch up and trying to figure out how exactly this is going to play out in Boston. So just want to acknowledge that. And then I know that it can be frustrating to feel like, we're still figuring it out and answering questions even after the state has released information. For the next meeting, we don't have a date and time yet, but we will email everyone who registered for this event and everyone who's registered in the past for our Friday meetings. We'll also put that on our social media at Arts in Boston. So please stay tuned and we'll likely see you in a couple of weeks.